As a Canadian living abroad, I try to stay up to date with Canadian news. And I've been seeing a lot of this lately.
More than 4,000 excess deaths due to delayed care unrelated to COVID. And that only covers the period between August and December 2020.
Since May, in Alberta alone, 7 patients have died waiting for emergency care.
Who waited in a Winnipeg emergency room for 19 hours for an injured ankle. In Ottawa, Montfort Hospital closed its emergency department overnight this weekend amid what it calls an unprecedented shortage of nurses.
Lengthy wait times for emergency care have become all too familiar right across the country. This same patient had waited 16 hours yesterday in another hospital without being seen for his pain. He left. I couldn't do anything. He died within minutes of his arrival.
Doctor shortages, outrageous emergency room wait times, and people saying that the healthcare system is on the edge of collapse. So it doesn't sound like things in Canada are going too well. This is shocking considering that some lists put Canadian healthcare as among the best in the world. But all of this got me wondering about what things are like in Lithuania. Is it better? And how does Lithuania's healthcare system compare to other EU countries? Well, that's something I hope to look at in today's video. So, like Canada, Lithuania has universal healthcare. This means that there is a government-funded system of hospitals and clinics that take care of emergency and non-emergency conditions. If you're employed by a company in Lithuania, then you'll have your contributions deducted from each paycheck. If you're self-employed, then you'll have to make the contributions yourself. Ultimately, if you're paying into this system, then you have the right to access public health facilities free of charge. Well, since you've already paid for it. It's worth noting that tourists and non-residents can use government facilities too, but then they'll need to pay directly for the services they use. There are also private hospitals and clinics which anyone can go to if they have the money or proper insurance coverage. So how is the public system performing in Lithuania? Well, according to government statistics, nearly 270,000 operations were carried out in 2021, with the most common surgeries being fracture-related at 20%. At about 17% were gastrointestinal-related surgeries, and a little over 10% were gynecological. A Ministry of Health representative told me that wait time statistics aren't publicly available. However, they did tell me that Lithuanian law mandates that a patient must be seen by a primary care specialist, like a family doctor, within 7 days, and by a secondary care specialist within 30 days. Today, I'm told around 80% of visits to the family doctor comply with the 7-day requirement, and I'm also told that this figure has been stable for the last few years. So far in 2022, 83% of admissions to secondary care specialists are made within 30 days. Of course, admission times vary by service and the specific condition, and some specialists are in short supply, while others are available. For example, I'm told a gynecologist is 94% on time, but it's only 54% for a maxillofacial surgeon, which is someone who performs surgery on or around the head, neck, mouth, jaw, and face. The representative at the Ministry of Health tells me that the Lithuanian Parliament is looking to reform its healthcare system, largely because of changing demographics. Factors include a rapidly aging Lithuanian population, emptying regions, and a growing need for mental health services. On the note of emptying regions, it was quite interesting to see so many town populations declining over the past 20 years. Of course, I doubt this trend of urbanization is unique to Lithuania, and is probably something you'll find around the world as well. Anyways, getting back to healthcare reform, the government is aiming to restructure ambulance services in Lithuania too, with the goal of having a single service. That's because there are currently more than 40 different ambulance services in Lithuania. I'm told that in some cases, one ambulance service might pick up a patient, but if they need to be transported to a different district, then a different ambulance service would meet the first one halfway and take the patient the rest of the way. If this actually is the case, then I would agree something needs to change. Growing up in the Canadian province of British Columbia, there is one service for the entire province. I believe in some parts of the United States, you'll find multiple private ambulance services in one city, and it's a bit strange to think that Yelp reviews exist for emergency medical services. But that's the American healthcare system. Another area of reform has to do with family doctors. The ministry tells me that the aim of the reform is to provide patients with as many health services as possible through family doctors, rather than doctors referring patients to specialists. Additionally, health services will be digitized so that as many services as possible are recorded digitally instead of on paper. The The government also wants to expand outpatient mental health services, increasing access to psychologists and psychiatrists across Lithuania. Essential services will be concentrated as close to people as possible, while specialized services will be relocated to major hospitals with highly qualified specialists. While it's easy for any public relations person or communication specialist to provide statistics and future goals, I did find it quite refreshing that the Ministry of Health also answered my questions regarding areas of improvement and weaknesses in the system. On this topic, I was told that shortages of certain healthcare professionals persist in Lithuania. One big reason for this is that the system must compete with other, much richer countries who try to recruit medical professionals from Lithuania. As just one example, a Lithuanian doctor I know was offered a very high-paying position in Kuwait, and I can imagine things like this happening all the time. Perhaps the most interesting issue raised was the problem of corruption. The representative at the Ministry of Health told me that the health system is perceived as corrupt by Lithuanian society, and that this is due to various kickbacks and bribes paid to medical staff. My Lithuanian doctor friend tells me that every now and then a patient, or the family member of a patient, tries to say thank you with a handful of money. Whether or not this is intended as a bribe probably depends on each situation, but things like this do appear shady. By the way, my friend always refuses, and even has to be quite blunt and even rude, just because of how insistent people can be. This doctor friend also tells me that pharmaceutical representatives used to be quite generous with gifts, hoping to persuade a doctor or a hospital to buy their products. Thankfully, it seems like Lithuania has taken action on this particular issue, since the practice is now banned in the country. Interestingly though, it does seem to be a generally accepted form of persuasion, particularly in the United States.
While they spend nearly $4 billion a year marketing directly to us, they spend an estimated $24 billion a year marketing directly to doctors.
There are some offices that advertise in the front desk job description free lunch every day. Not because the doctors are paying for it, because the drug reps are bringing it in every day.
So those were the problems identified by the ministry's representative. But what about things that Lithuanians can be proud of? Well, on this topic, it was noted that 80% of healthcare in Lithuania is public and financed through taxes. According to the World Health Organization, Lithuania's public health system is among the top 10 health systems in the EU, and additionally, Lithuania has 2 university hospitals that are also research centers, with a 3rd university hospital soon to be established in Klaipėda. I'm also told that Lithuania has a fairly high rate of doctor training when compared to other EU countries, and that doctors from Lithuania are in very high demand in many other countries as well. I know 2 foreigners here in Vilnius studying to become doctors, but they won't be sticking around to work in the Lithuanian system. So the training rate might be high, but this might not be a direct benefit to the Lithuanian healthcare system. I took my curiosity to the Foreigners in Vilnius Facebook page and asked others about their experiences and opinions regarding Lithuania's healthcare system. Multiple people reported having to deal with long wait times, although I don't know about the specifics of each situation. 2 people mentioned that their experience in Lithuania was better than their experiences of the US system, while 3 people said it's better than the UK system, the NHS. A few people mentioned having to deal with rude doctors, but I think this definitely depends on the location and who you deal with, since a few others had nothing but positive things to say about their healthcare experiences. And on that note, I did want to include the specific words of one person who said, "It depends on the clinics you visit. I'm highly satisfied with my family doctor and facilities or staff of the clinics. Whenever I need something, my family doctor calls multiple times to check on me and always advises more than I asked. What I was positively surprised by is that she always asks if I can afford doing certain checkups at the clinics she works. If I say that something is out of my budget, she always gives me cheaper options elsewhere and writes me directions that maybe I might not know since I'm not a local." And so, to wrap things up, I haven't had to deal directly with the Lithuanian healthcare system myself, yet. And hopefully I can keep it that way. But of course, I hope that by the time I do need urgent medical attention, the systemic issues stated won't be as significant. And so, for Lithuanians watching, what is your opinion and experience of the public healthcare system here? And of course, if you're watching from somewhere else, what are things like in your country? Let me know by leaving a comment. Thanks for watching, and I'll see you next time.